Thursday, Dec. 6, 2018, HealthDay News. Heart patients taking part in cardiac rehabilitation could receive a spicy side effect from the program, a boost in their life. Attending cardiac rehab is associated with improved UAL function and more frequent, according to a new evidence review. The program likely helps by increasing the patient's physical fitness, said lead researcher Selena Boothby, of the University of Calgary, in Canada. There is a relationship between UAL health and physical health. If you're more able to be physically active, you're more able to be UAL active, said Boothby, a research assistant in the Department of Community Health Sciences. However, the researchers did not find any strong link between cardiac rehab and UAL satisfaction. Cardiac rehabilitation is a medically supervised program designed to improve the heart health of people who've had a heart attack or heart failure, or have undergone angioplasty or heart surgery, according to the American Heart Association. Rehab involves exercise counseling and training to improve fitness, education on heart-healthy living, and counseling to reduce stress. For this review, Boothby and her colleagues pored through medical literature and found 14 studies that evaluated cardiac rehab's potential effect on a person's life. Of 6 studies pertaining specifically to UAL function, 3 showed improvement after cardiac rehab and 2 showed mixed results, the researchers found. Only 1 showed worsened function following rehab. Study results also showed that people tend to have more often after attending cardiac rehabilitation, compared with those who don't take part in the program. Most of the research focused on men, Boothby said. But it could be expected that women would benefit similarly from cardiac rehabilitation. There is just a lack of research being conducted on females right now for this whole topic, Boothby said. There are 3 ways heart disease can impact UALity, the researchers explained. For 1, physical limitations, like fatigue, shortness of breath, chest pain, erectile dysfunction and vaginal dryness, are common among people recovering from a heart problem. In addition, blood pressure drugs have been associated with UAL dysfunction in men and decreased UAL response in women. Finally, feelings of anxiety, fear and depression are common in heart disease patients, increasing apprehension around. These problems can become a vicious circle that is hard to break, said Dr. Claudio Gil Soares-Araújo, Director of Research and Education for the Exercise Medicine Clinic, CLINIMEX, in Rio de Janeiro, Brazil, regularly attending a cardiac rehabilitation program that will help to lose body fat, to gain muscles, to become more flexible, and to improve balance and the capacity to tolerate higher exercise intensity for longer periods of time is perhaps one of the best ways to help the UAL life of a man or woman with heart disease, said Araújo, who wrote an editorial accompanying the study. The positive benefits appear to stem largely from the exercise portion of cardiac rehab. There was no clear association between UAL activity and rehab programs that included psychological counseling, the findings showed. Sex is on the minds of many people with heart problems, Boothby said, and their concerns aren't likely to be addressed while they're in the hospital or preparing to leave for home. Sometimes discharge is very hectic. Patients are often getting a lot of information about their medications and physical activity, and then they're discharged, she said. That's not necessarily the best place to receive that information. Previous research has shown that couples are very open to receiving UAL activity support within a cardiac rehabilitation program, Boothby added. However, more study needs to be done on during recovery, she suggested, as there are still gaps in knowledge. Sexual activity is very important to overall quality of life, and heart patients are living longer with cardiovascular disease than they ever were before, Boothby said.